Hello, I am Dr. Keith Burke, a professor of behavioral sciences in the Alcohol and Other Drug Studies program at San Diego City College. The AODS program is a fully accredited college-level coursework program that is designed to train students in the required coursework needed to become a certified alcohol and drug counselor in the state of California. Today, I'm going to talk about group counseling in substance use treatment programs. So why group counseling? Overwhelmingly, the majority of the counseling that a client receives while in substance use treatment is group counseling. The minimum California requirement for certified and licensed substance use treatment facilities is that clients receive individual counseling at least once every 30 days, with recognition that once a week is ideal. But depending upon the type of treatment program that the person is in, meaning they could be in an outpatient program or a residential inpatient program, a detox program, clients will receive group counseling somewhere between 3 and 10 sessions per week on average, and more in some programs. So group counseling has been used in clinical settings in the United States since the early 1900s. And some of the rationale for that is that people are born into groups. They're born into family systems. They're also very strongly influenced by groups. Young children learn from watching their parents and their siblings and their society and their culture, and this continues on throughout the lifetime. People are very strongly influenced by the group that they're surrounded by and what the group thinks and what the group's beliefs are. If nothing else, it gives people some measure where they can decide what they actually think compared to what the group is thinking. We also know that groups provide a social model of recovery that includes support and learning from others. What I mean by that is that in a treatment setting, if somebody is in group counseling and they're sharing about their experiences, they may be able to receive support from other people who are in the group who have had similar experiences. They're also able to learn from others as others have worked through things in their own recovery process and their own treatment. That might be something that others may identify with and be able to learn from their peers. Groups can also support healthy behavior better through social reinforcement. So, for example, if somebody was in an outpatient treatment program, they've been there for 17 days, and they bring up in group counseling, you know, there's this new girl, I'm really into her, and I mean, she smokes pot, but I don't know, that's okay. Pot never really was my drug of choice anyway. The group may be able to intervene on that and have a discussion about this and some of the risks versus benefits of doing this. And the group may actually help swing the thought that the person has about whether or not they should be spending time with someone who's actively using drugs while they're in early recovery. Equally, groups can support deviant behavior through social reinforcement. Many people who develop substance use disorders were very strongly influenced by groups of people who encouraged them to continue using substances despite the negative consequences. Additionally, groups are ideal for addressing behaviors, emotions, and interactions in relationship. We will have a lesson later on the interpersonal process group where this will be even more relevant. But suffice it to say that people in substance use treatment often come into treatment with some challenges in terms of their behaviors, how they experience their emotions, and how they interact with other people. And groups is really an ideal setting for addressing that, because unlike a one-on-one individual counseling session where it's a person meeting just with their therapist, in groups, there'll be plenty of opportunities to interact with others in a relational setting. And a trained facilitator is going to be able to intervene and use that as part of the therapeutic process. So let's just talk about the nuts and bolts of all types of group counseling formats in substance use treatment. The general goals for all substance use disorder treatment groups is to provide education on the symptoms, causes, effects, and treatment of substance use disorders. So with that, that includes introducing members to recovery concepts, cravings management, relapse prevention strategies. And groups will provide an opportunity to give and receive feedback from peers on their experiences, their attitudes, and their behaviors. Additionally, group therapy and substance use treatment creates an environment where feelings, thoughts, and conflicts can be explored in a safe and supportive environment that doesn't lead to reaching for the drug of choice. Groups are also an ideal place to teach coping skills and to manage substance use and mental health disorders. The AODS 159 co-occurring disorders course in the AODS program goes into much greater detail about helping people with substance use disorders also manage their mental health disorders. But suffice it to say that many people with substance use disorders often have mental health disorders as well. And group is a great place to both teach and practice coping skills to manage both disorders. So examples of this could be practicing these skills in a group setting and then practicing it with peers. For example, if somebody was triggered by another group member and they've learned one coping skill when they're feeling triggered is to take a deep breath instead of bursting out in anger. And so they can practice that in group. And then when they go outside of a treatment facility, they may be able to practice that with other peers. They can use group to ask for help and support. In group, we can teach them coping skills to resolve relationships and problems that they're having with somebody else who might be in the group. And groups can be used to challenge distorted or addictive thinking. All substance use treatment groups will have norms or rules. So a norm is setting up an expectation of what is normal and expected in group. For example, participation is a pretty common group norm, meaning that it is expected that you will participate in the group. You will speak up, you will share, you will be supportive of others. You won't just sit back and watch group as if you're watching a television. Rules set up what you can and cannot do and consequences for the groups. So there may be a rule, for example, that people are not allowed to use their cell phone while they're in a group counseling setting. And if they do use their cell phone, then the first time they're given the opportunity to put it away. And if they do it a second time, then they have to leave the group. So all groups will have some kind of established norms and rules. Norms and rules can be formal or informal, meaning that the agency might have an actual list of rules and norms that are provided, or this may be discussed in an ad hoc fashion. As things come up in group, there might be an agreement that going forward, this is what's going to be expected in this group. Norms and rules play a really important role in creating a sense of stability, meaning that people know what's expected of them in group. Group creates a certain routine and a type of stable interaction. There are a number of specific types of groups that are used in substance use treatment. So one group in substance use treatment is the support group. In fact, many people experience the support group as their first type of group interaction when they're trying to get sober. Now, support groups exist outside of treatment facilities. So 12-step groups, all the anonymous groups, Alcoholics Anonymous, Narcotics Anonymous, Heroin Anonymous, all of these are types of support groups where people get together as peers and give each other support and talk about the process of their own substance use disorder and addiction. Oftentimes, support groups are also included either as part of the actual substance use treatment or as an auxiliary treatment, meaning that there may be an outpatient program where somebody goes to group 3 days a week at the treatment facility. They're expected to also attend, say, 2 support groups outside of treatment facilities and bring back proof that they attended those groups. Many treatment facilities, in fact, probably all or almost all treatment facilities will have some kind of psychoeducational groups. So a psychoeducational group is a group where a lesson is being delivered in some way. They're providing education. So for example, people may learn about the biology of addiction or how drugs and alcohol affect the brain. Substance use treatment facilities have skills development groups. So skills development groups are groups in which you not only learn about a skill, but you have an opportunity to practice that. Many treatment facilities may have an anger management group where people will do scenarios and role play what they might have done based on their own impulse versus what they can do now that they learned a different skill set. Most treatment facilities nowadays have some kind of cognitive behavioral therapy group or dialectical behavioral therapy group. We are not going to talk about these groups in detail in the AODS 160 course, but we do talk about them at much greater length in the AODS 159 co-occurring disorders course. So a CBT or a DBT group is pretty much utilizing the group so that people can learn to change their thinking and learn how to regulate their emotional state. And then there are interpersonal process groups, or sometimes shortened in treatment facilities to just process groups. So process groups are much less structured. Process groups are a place where clients can practice social and emotional learning through their interactions with others. And we will have a lesson on interpersonal process groups by themselves later in the semester. So the appropriate topics for group counseling. When we are running group counseling in a substance use treatment facility, then everything that's talked about in those group settings should at least be loosely related to or directly related to factors that might contribute to why somebody uses substances. So it's substance use treatment. That's the reason why people are in treatment, and that's why we're running the group. So the topics in the group shouldn't be about the latest heat wave that's happening, or their prognosis for the upcoming football season. What we want to do is make sure the topics are related in some way to substance use. And primarily, we want people to try and understand why they use substances. Everybody uses substances for a reason. They serve some purpose. And so a very important part of treatment is trying to identify what are those factors that led to somebody using substances. For example, somebody may have had a traumatic experience, or multiple traumatic experiences that have caused them to often feel anxiety when they're around other people. And so they may have originally started using, let's say, alcohol, because alcohol allowed them to feel more comfortable when they are around other people. So that then becomes associated with the alcohol use and can become a kind of trigger, so that every time the person is around other people, they use alcohol to try and deal with their anxiety symptoms. So a topic of discussion like that would be totally appropriate in group. Group topics also should be related to risk factors or triggers and specific plans that relate to relapse prevention. So we want to understand why somebody uses substances in the first place, so then we can try to identify what's going to stop them from using in a problematic way or using altogether when they leave treatment. Also, it's appropriate in group to talk about what are commonly referred to as re-entry skills. Many times people that come into substance use treatment have got a lot of other challenges and problems that have developed because of their substance use disorder. So talking about securing housing, that is supportive of sobriety. So moving into a sober support home or something versus moving back in, with the ex who's still an active drug user. Employment, addressing employment concerns, updating resumes, how to deal with if an employer asks why you haven't worked for the last 5 years. These are totally appropriate topics in a substance use treatment group, because many people are going to be going through the same experience, and people might be able to learn from each other and support each other. And then addressing medical factors that might be contributing to substance use treatments. Somebody who has chronic pain and who has been using opiates to treat that may be able to talk with other people who have had a similar experience and talk about alternatives. And of course, developing a stable support system. So when somebody leaves treatment, much like when you first sprain an ankle, you usually might have a brace or some sort of support that you wear as you rehabilitate that ankle. It is pretty much standard canon in substance use treatment that people need to set up a stable, sober support system for when they first leave treatment in order to get past that first 90 days when relapse risk is generally very high post-treatment. All right, let's talk about doing work in group counseling. So in order for any type of group counseling to be therapeutic, the group members must be engaged in work. Now, work is a phrase that I think was first coined by Irv Yalom, who has had a tremendous impact on group counseling in the United States and beyond. We'll learn more about Irv Yalom later on in the semester. Yalom used the phrase work, and that's something that always really resonated with me. And so that'll be the phrase that I use both in this lesson and in subsequent lessons. So the idea is that you're coming to a counseling setting to do work. You're not just filling up time. So the idea isn't like, well, we got 60 minutes together, let's figure out what we can do to get through this. What we want to do is use the time to actually do some work. Now, work may include identifying the presenting issues, the things somebody is struggling with currently in their life. Work may mean gaining education or support in some way. Work may be engaging in problem solving. So taking a presenting issue and then trying to come up with a solution of how to handle that issue. Work may entail practicing new behavioral skills in a group setting that perhaps then you can apply to the outside world. And work is managing the relational dynamics in the group. So anytime you get a group of people together and they're expected to be working in something related to treatment that's causing them distress, that will often trigger relationship dynamics between people that may or may not be nice or pleasant. And so the managing of relationship dynamics in the group is a very important aspect of work and group counseling, with the idea that these skills that you learn in managing the dynamics in the group, you can apply those lessons in the outer world. We'll have a subsequent lesson that goes into much greater detail about that. So the work that the client does in a group setting is a type of treatment goal. And generally, goals that somebody's working on in group should be included on the treatment plan. It should be clear to both the counselor and the client what specifically the client is working on in the group setting, meaning that maybe one of the things the client is trying to work on in group is identifying what they're feeling at any given moment and having the courage to express that feeling to somebody else. So that would be a completely appropriate goal. And so what we may have on the treatment plan is, client will work on identifying feelings and expressing those feelings in the process group that meets on Monday and Thursday. And then while in group, the counselor or counselors should be really clear on what the client's working on. So for example, as the group is talking about some kind of a controversial topic, let's see, whether or not you should be involved in relationships when you start a relationship when you first leave treatment. Perhaps the client who's working on identifying feelings, might furrow their brow, and the counselor, knowing that that client is working on identifying feelings and expressing them in group, may turn and say, Mariah, I noticed that you had a reaction when James was talking about how he thinks it's not a problem to get involved in relationships when you first leave treatment. Can you talk about what your opinion is on this and what feelings this is bringing up for you? The idea being that counselor and client are facilitating the treatment goal of identifying feelings. Now, most of the time, it's also usually going to be clear, either explicitly or through interpretation by the other clients in the group, what the person's working on as well. Most of the time, in my experience, it's very helpful when everybody in the group has a sense of what everybody else is working on, because then you can provide support. So it may not be the facilitator who's asking our client what she's feeling. It might be another client saying, hey, I'm wondering what you feel about this. You get the idea. So in a psychoeducational group, the work might be learning a topic, or not a lesion, that was a typo, learning the topic or lesson. I'll have to fix that. In a skills group, the work might be practicing a new skill, right? For example, in an anger management group. In an interpersonal process group, the work might be learning how to relate with and support other people. So here's the problem. Group members don't often want to do work. Doing work is hard. That's one of the reasons why Yalom called it work, and why I like using that phrase also. It's hard to go to counseling. If you're in counseling and you're working on something that's causing you stress or anxiety or challenges in your life, most people don't want to do things that are hard. And so typically in a group counseling setting, people aren't going to want to do work. They're not going to work on things while they're in group. And so instead, what tends to happen is people will withdraw. They just won't speak up, or they won't engage with the topic, or they won't say anything to their peers. Or sometimes people will avoid doing work by filling up the space with words without making any real progress or life changes. And what I mean by filling up the space with words is, facilitator may call on them, we haven't heard anything from you today, like, how are you reacting to the topic? I don't know about the topic. I'm just feeling like really hot, man. Have you noticed how hot it's been lately? It's been so hot and humid. It's really weird. It reminds me of back when I lived in New Orleans. In New Orleans, we always had like fans, and sometimes I'd sleep out in the porch. This is not doing work in a counseling setting. This is just filling up space with words, and it's not making any real progress or life changes. So most of the time, people will withdraw or fill up space because of treatment ambivalence or treatment resistance, meaning so ambivalence is wanting two opposing things at the same time. So part of them might think that they want treatment, would benefit from treatment, but some other part of them doesn't really want to be in treatment, and they definitely don't want to do work. And then resistance is just a resistance to not wanting to do work related to treatment. So there's lots of ways that people can resist doing work in group. So one way to do that is to talk about things unrelated to substance use or meaningful dialogue. So I just gave an example of somebody talking about heat and humidity and how it relates to living in New Orleans. That might be a totally appropriate topic if you were at a tea party, right, or a social gathering. It is not an appropriate topic when you're in group. So a phrase for when people are talking about things unrelated to treatment might be having a tea party. Another way people avoid doing work in group is by telling war stories about the past that are not relevant to current treatment goals. So it is possible to talk about experiences that you've had in the past that are related to current treatment goals. If somebody were to say, man, I'm just really having a hard time, with this. I go through treatment, I can do treatment, but like every time I just relapse as soon as I get out. It's like, the last time I was here, I thought I was really good. I got a sponsor, and then man, I relapsed 3 weeks after I left treatment. I'm really struggling with, why I can't stay sober when I leave treatment. Now that's telling something about past experiences related to substance use that might be relevant to the current treatment goal. Developing an appropriate relapse prevention plan and a sober support system to stay sober in those critical days of early recovery. But there's other people who will go to group and they'll just fill up time talking about something that's not really relevant. Like, oh yeah, man, back when I was in my addiction, I'd be on like a 20-day bender of just using crank, and I would be so focused on cleaning, and I'd get the toothbrush out. And I remember one time I was totally up in the corners of my ceiling, and I was cleaning out, the corners with the toothbrush, and there were spiders up there. And so this would be an example of somebody telling a story that really doesn't have anything to do with the current treatment goals. So very easy to misinterpret this. In fact, sometimes the beginning or untrained facilitator might feel like, oh, wow, my group's really talking about a lot of things. We're having a really good group. So the key question to go back to again is, are we actually doing work? Another way to avoid doing work in group is to focus on the others in the group and try and fix their problems. So if I'm ambivalent about being in group, I'm ambivalent about being in substance use treatment, and somebody in the group brings up that they're having marital problems, with their spouse, I may decide that a really good way to kill time in group is to really focus on that person and talk about what they should be doing and how they should do this and that. And I'll give them lots of advice, and everybody piles on, and we all start trying to fix somebody else's problems. We're always an expert when it comes to fixing somebody else's problem, and it's a convenient thing to do when we don't really want to talk about what's going on with us. So we'll talk more about fix-it groups in a subsequent lesson as well. Fix-it groups are a classic defense mechanism to avoid working on myself. Generating or participating in interpersonal conflicts without taking personal responsibility for their role. So again, as mentioned earlier, group can be really super helpful for learning how to manage relational dynamics. And by working through things, learning how to assert ourselves in group, working through conflict resolution, learning how to set boundaries with others in group, those are all appropriate treatment goals and all appropriate work. But a lot of times what will happen in group is, people just develop some kind of a conflict and man, who are you? You're such a know-it-all. why you always got an answer to everything? And then the person sitting next to me is like, yeah, man, like, God, I'm sick of hearing from you. And then the other person's like, yeah, well, fuck you, man. This is what I thought group was all about. And somebody else is like, whoa, why do you got to swear? That's like not right. And now we got all this conflict going on. But nobody's actually doing anything about this. Nobody's taking responsibility for their role in that. Nobody is evaluating why they felt so triggered when somebody used a swear word. Nobody's trying to actually set up an appropriate boundary or use an I statement to make a request. All those things are examples of how you might turn an interpersonal conflict into work and be able to do something about that. But many times you'll see people avoiding doing work by just creating conflicts. I don't like her, man, I don't know why. Okay. And then obviously one way to avoid doing work is simply either directly or indirectly refusing to participate. So that often happens too, right? Person sitting there, pulling out their phone, staring at the clock, like obviously not wanting to be there. And when they're called upon, they refuse to participate. That's definitely no work either. So one of the key things, whatever group you are running in a substance use treatment facility, is to make sure that the group gets back on track. So when the group is off track and they're not doing work using one of the things that we just talked about, this will most often require the facilitator to step in and help to get the group back on track and focused on doing work. This is true for all of the groups. So if somebody's running a psychoeducational group and the lesson of the day, somebody raises their hand and they're like, yeah, I relate to that. And then they start talking about something that has nothing to do with the lesson. And 3 or 4 more people are now talking about that. And now we got somebody telling war stories. Then the facilitator may need to cut in and say, okay, hold on, everybody. I really appreciate all the sharing that everybody's doing, but we've kind of gotten off our agenda, which is to go back and talk about relapse prevention today in this group. So let's go back to talk about that. In an interpersonal process group, we may have a fix-it group developing, and the facilitator might say, I'm noticing everybody's working really hard at giving Serena advice, but I'm wondering if instead we can focus on using I statements and talking about how we identify with what Serena's going through. And if you've had any experience with addressing this issue, how have you handled it in the past? So these would be examples of the facilitator stepping in to get group back on track. Now, note that sometimes group members may be able to redirect the group themselves. A really high-functioning group, this will often happen, or if the group has a senior member, somebody who's been in the group for a while, maybe is a little further in their own recovery process, they may step in themselves to say, guys, this doesn't have anything to do with what we were talking about, and I really want to hear the lesson. But ultimately, it's the facilitator's responsibility and role to make sure that the group is on track. All right, let's talk about some basic group facilitator skills. So the following are some of the basic skills that you need in order to facilitate a group. So one is setting the agenda and the objectives for the group, meaning that the facilitator needs to have an understanding of why this group is meeting, what the purpose of the group is, and ultimately what we hope to get out of today's group. The facilitator also uses gatekeeping skills to direct the flow of discussion and conversation. Gatekeeping is a phrase that basically means controlling who can speak at any given time, making platforms for other people to speak. I like to think of gatekeeping in some ways as like the traffic police person when the traffic light is out. And he or she is standing out there saying, okay, wait, you guys wait. And then they're pointing in this direction and they're saying, you come this way, like keep coming, okay, wait. Okay, now you all can come here. That's an example of gatekeeping, and a facilitator will have to do that in group. So Mario, I'd like to hear more from you on this topic. We haven't heard anything from you today. Yes, Gavin, that's really, like, I really appreciate the share. Before you head off in that direction, though, I'd like to keep us on track and hear from some of the other people who've raised their hands. So that's an example of using gatekeeping. Very important skill. Encouraging participation by all members. If somebody is in a group in a treatment facility, then they're in treatment. And the expectation is that all the members who are participating in group counseling actually participate in group counseling. Now, again, one of the great ways to avoid doing work is simply to not participate. And if the group has a big talker or a couple of big talkers who tend to dominate the group, and every single time the group gets together, it's the same 3 or 4 people who are talking, then the facilitator is going to have to encourage participation by all the members, usually using gatekeeping skills, where it may be something like, okay, I'd like to hear from some of the people we don't usually hear from today. So I'm going to call on Roberta. So that would be making sure that Roberta gets a chance to participate. Using active and reflecting listening to ensure that members feel heard and understood. We will have a subsequent lesson on active and reflective listening, but essentially it's reflecting back what somebody just said to make sure they feel heard. So it may be something like saying, so Letitia, what I think I'm hearing you say is, and you repeat back what she said, do I have that right? Letitia says, yeah, exactly. Okay, got it. That's actually a really good question. Let's put that out to the group. Interrupting, summarizing, and redirecting when a group member is dominating the discussion. Interrupting is one of the basic foundational skills of facilitating group. If we can't interrupt somebody, then group will often get off track. So for people who are shy or have been conditioned by their own society that you should never interrupt people because it's rude, that's something that you will need to work through when you're doing work as a group counselor. And there is a way, there is a way to gracefully interrupt, which we'll talk about in a subsequent lesson as well. Maintaining and enforcing, when necessary, the group norms and rules, making sure everybody understands what's expected of them. Redirecting topics towards substance use and recovery, or factors that may contribute to substance use when the group gets off track. Reframing you statements and advice giving, or the fix-it group, to encourage clients to focus on themselves and their own process. So how does this relate to your recovery? And identifying and encouraging the active practice of different or alternative behaviors. Other facilitating skills include using motivational interviewing and other solution-based techniques to evoke change, to help people identify their own solutions and to encourage personal reflections. Providing in-the-moment psychoeducation that can be applied to the situation, general treatment or recovery process. What I mean by that is that you aren't only providing psychoeducation in a psychoeducation group. So somebody, you might be running, say, an interpersonal process group, and somebody brings up a topic and they say, yeah, well, marijuana is legal in the state of California, so I don't see why that's a problem. If I smoke pot when I leave, at least I'm not using heroin. And somebody else says, yeah, like, and pot's not even addictive. Like, you know, it's, you know, I heard that from somebody. Then you might have an opportunity to step in and say, well, okay, so hold on for just a second. Marijuana is legal in the state of California, the same way that alcohol is legal in the state of California. However, both alcohol and marijuana are both addictive. They both, after repeated use, will create tolerance. They each have withdrawal symptoms, yada, yada, yada. You start to explain the process. So that's taking a moment of psychoeducation before the group gets back on track. All right, and then it's up to the facilitator to create opportunities to practice new skills in the group setting. So this may be done in a skills group, where that's actually part of the agenda for the group, is to learn a skill and then to practice that skill in the group. But this also could be done in any group. So maybe it is a DBT or dialectical behavioral therapy group, and the group is starting to get really agitated and upset because they think some new rule that the facility has implemented is unfair. And so the facilitator may step in and say, wow, you know, I'm noticing a lot of people are starting to get really elevated and upset and angry. This might actually be a good time for us to practice that deep breathing technique that we talked about last week and see how that impacts your emotional state right now. So let's all do this. Let's practice the deep breathing. And so that's creating an opportunity to practice a new skill. Okay. Some other leader skills that you will use in group settings is ensuring emotional safety. Group only works when people feel safe enough to share and express. Stimulating communication and emotional expression. Resolving ethical issues that may come up in group. Resolving ethical issues may be something Like, for example, somebody is expressing they're thinking of hurting themselves. That's an ethical issue. There's a requirement in California that substance use counselors act on that statement, follow up to determine if the person's thinking of hurting themselves, if they have the plans and means to do so, and then reporting that when necessary. Addressing disruptive behavior as it comes up in group. Adjusting your style to the needs of the group. That's a very important skill. Your style may be very, your style may be very dramatic. You're a very high energy facilitator. And, you know, sometimes you even like to step up out of your chair and stride in the middle of the group. And you're like, yeah, I'm really excited about what's happening here in group, you know, like what's going on right now. High fives, you know, from the group. I mean, that might be a style that you have, but, you know, while somebody is talking about a very somber experience, maybe they've got to, you know, put their dog down because their dog has, you know, cancer, and other people are feeling really triggered, that would not be the time to use an overly energetic style in the group. So you'll need to adjust your style depending upon the particular group. Knowing when to be silent. We'll talk a bit more about this also a little later on the semester. So the use of the pregnant pause, or knowing when by not saying something, you might actually end up creating a more therapeutic process for the people in group. And avoid taking on outside of group roles or dual relationships. This is talked a lot about in the AODS 154, the Law and Ethics course in the AODS program, but the importance of understanding what your role is as the facilitator, as the substance use counselor, and not trying to take on other roles like becoming the client's friends, going outside in the smoking circle, and, you know, BSing with them in a way that, you know, makes you no longer in the counselor role, or you try to sell them, you know, something from this new job venture you're starting. So avoiding outside of the group roles. Okay, so client reveals, counselor listens, hopefully in the middle of that is understanding. The last skill I want to touch upon is the importance of empathy as the foundational skill, meaning that all of the other skills that you learn in the AODS program, the most important one is to have empathy. So there is lots of research that indicates that empathy is the most important counselor skill. And empathy in substance use treatment means that you have to have the desire and the willingness to work with people who are not always very well behaved or nice to be around. People who are in drug treatment and alcohol treatment are often coming there and they're a mess. Their lives are a mess. Their emotional state is a mess. You know, they're upset, they're craving, they're ambivalent, they don't want to be there. And sometimes that means that, you know, they're not necessarily very nice. And so we have to be able to understand, like, man, I get it. I know where you're at. I feel your pain. I understand. I feel empathy. It also means that you make a concerted effort to understand the client's actions and point of view, even when they're being difficult, confrontational, or highly resistant. So if a client, for example, suddenly is shouting at you about how you're such a horrible counselor, and you don't know what the hell you're doing, in the outside world, when you're not wearing the clinical counselor hat, you know, you may respond in a defensive way. Hey, man, like, why are you talking to me that way? Like, I've been to school. I know what I'm doing. Whereas in a substance use treatment facility, it's very important to say, like, okay, so it sounds like you're really upset with me, and I really want to try and understand what's going on. What was it that I said or did that's making you feel as if I don't know what it is that I'm doing? So there are numerous studies out there showing that an empathetic counselor improves treatment outcomes, both in treatment and beyond treatment. There's a nice, cute little YouTube video by Brene Brown on empathy, and that YouTube link right there. I'm not going to play it for you right now because unfortunately I get blocked by Zoom if I try to play the YouTube video through the link there. I've got to do something different. There's also a very famous study that was done in 1993 where they took a number of people in substance use treatment and they randomly placed them in two types of treatment. So the client either got assigned to counselors that were using a very client-centered, empathetic style, trying to understand where the person's coming from, or they got very directive confrontational counseling. Things like, look, you just need to admit to yourself you're an addict. Until you admit to yourself that you're an addict and you've completely screwed up your family life, then you're not going to get any better. What they found was when somebody was assigned to the confrontational counseling, it tended to increase their substance use. In fact, it increased even more than when they first came into treatment. So the more confrontational the type of treatment that people received, the more they drank. Whereas the people that got client-centered empathetic counseling tended to stay in the treatment, finish the treatment, and stayed sober for longer after they left treatment. All right. So that takes us to the end of our introductory lesson in group counseling. There's a couple of cute little cartoons here. The Christmas group therapy in the upper left-hand corner. Santa doesn't believe in himself. Snowman thinks he's bipolar. All the other reindeers laughing and calling me names. Elf is trapped in a dead-end job. Interrupters Anonymous. Hi, my name is Timmy, and hello, my name is, and hi, my name is. That's Interrupters Anonymous. And then the Halloween group therapy that's listed down there on the bottom. So I hope this lesson has provided you with a good initial overview of the group process in substance use treatment. And as I mentioned a couple of times, subsequent lessons will get into more detail about a number of the other types of group counseling skills that we'll be working on this semester. All right, so until next time.